Hello, everybody, and welcome to another episode of the Atlantic CIL podcast. I'm here with Vicki Phillips of the Mental Health Association in Atlantic County. Hi, Vicki. How are you?
Good. How are you, Donald? Nice to
I'm
be
good.
here.
Yep, and we've known each other for a long time. It's been 7 years now. Best 7 years of your life. And,
Seems
and
like just yesterday.
seems like just yesterday. And we're here to talk about MHA and what they do, and also the stigma that exists in the mental health community and how that can impact and create barriers for the disability community working together. And also, we're going to talk about our Inclusive Healthy Communities Grant, which is funded by the Division of Disability Services. So let's get started, Vicky. Let's talk about what is the Mental Health Association and what do they do? Let's start there.
Sure. So the Mental Health Association is a private nonprofit organization we are a statewide organization that also has some local affiliate offices throughout New Jersey. And then we are also part of a national organization called Mental Health America. It's a little confusing that the Mental Health Association and Mental Health America have two different names, but it was probably about a decade ago they decided to rebrand themselves nationally to Mental Health America and then left it up to each state to decide whether to stay with the Mental Health Association name or go with Mental Health America. And some have slowly morphed over into like Mental Health of America in that county, but we've stayed with Mental Health Association in New Jersey, and we are the Atlantic County office. And our primary mission is to do supportive services. We do a range of sort of supportive services for individuals and with living with mental health disorders. And we also do a range of services for families who support a loved one with a mental health disorder or substance use disorder. We also do a ton of community education, some of which we're going to talk about today. And then another big piece of what we do as a local, statewide, and national organization is we follow any kind of legislation or issues that need legislation to bring about change. So we do a lot of advocacy on a systems level, but also on a personal level. When a family can't get the services they need, we help them work through that chain of command to get the services that they're looking for.
Awesome. And how did you get involved? I always like to know what people's origin story is because I think it's always cool and the listeners like it. So how did you get involved in this disability mental health world?
Well, actually, I graduated from Stockton, which at that point was Stockton State University or Stockton State College. And I came out with my degree in healthcare administration. My dad was a hospital administrator, my mother was a social worker. So I decided that I was going to try and find a job after doing a stint at one of the casinos for a year after college. I decided it was time to get a real job in the field that I had studied. So I came across an ad for this position at the Mental Health Association, and I interviewed and luckily got the position. And the rest is history. When I first came here, it was a organization that did a lot of community service work, and it also did we had a lot of volunteer staff that did a lot of great things for people who were struggling with mental health disorders. And so I had a team of volunteers that worked with me who did all kinds of things, from running social groups to like activity groups for people who were living in, at that time, we had over, in Atlantic City, we had over 550 people living in boarding homes in Atlantic City. This was back in the late 80s. And then we also had volunteers that worked as a friendly visitor for people who were leaving the state hospital and returning home, and they really didn't have any resources. So we had a whole core of volunteers that did that. And from there, pretty much every program that MHA now has in our county, I either worked on, created, and worked in, and then moved on to creating something else and worked in that program. So it's kind of been an evolution.
That's awesome. And now we're going to talk about kind of the trends that you've seen throughout your career. I feel like mental health as a person with a physical disability, I feel like mental health often gets forgotten in the disability community. And I was wondering your thoughts on that. And because I know as we've worked together, that's a barrier we've tried to break a lot. And as we work together on our Inclusive Healthy Communities grant, which listeners who've listened to other episodes know that we're working together on. So I was wondering your thoughts on that and how that has impacted people with mental health disabilities.
Well, in our book, how we feel at the Mental Health Association is basically you can't get through life without dealing with your mental health. I mean, you have physical health, you sometimes you can skate by and stay pretty well, but at some point you've got to come to terms with something going on in your mental health. I mean, when you look at the statistics, 1 in 4, 1 in 5 people will have some type of mental health disorder affect them sometime in their lifetime. So you can have a physical disability and you can have mental health issues. You can have a health disability and you can have issues around mental health. You can have a substance use disorder and you can have issues around mental health. But we have historically in this state, we have those groups that I all just mentioned work in silos. They're funded through silos. Each division has its own funding source. And whenever we cross trenches and try and get in the sandbox with others, you and I both know that people give you a hard time. Like, what are you doing in our sandbox? You shouldn't be playing. Go play in your own sandbox. And we don't see that we have like one sandbox that's ours. We kind of feel like, your mental health affects you all the way around throughout your lifetime. So we should be all working together to create programming that is inclusive rather than segregated.
Yeah, I think that's so true, and a barrier that does exist, and sometimes it feels really intentional from a funding perspective to keep us in silos. So I just think that's really important. And talk about the importance of advocacy, because I know you've seen a lot of advocacy throughout your career, which is really what we're trying to do here through our civic engagement grant. And a lot of people feel like, there's nothing I can do. I'm in this more marginalized community and I can't have an impact. But I know you always talk about the impact that you have seen throughout the years.
I think we always think that we do not have a voice as citizens, but we only have a voice if we only don't have that voice if we don't use it. And we have to learn how to use it constructively and thoughtfully. And we talk in our civic engagement grant and in our classes that we've developed a lot about partnering with like-minded people, because the more you are together standing side by side, the louder your voice is and the more it does affect those who are empowered to create that change, or who have the ability to at least guide you how to help create that change. For example, in the beginning, and this was in the mid to late 80s, when all these, two movements were popping up across the country. There was the family movement, which was really spurred by NAMI, which is the National Alliance for the Mentally Ill. And then there was the consumer movement, which were support groups all over the country, starting by people with lived experience in mental health. And the Mental Health Consumers Association out of Pennsylvania, Philadelphia, was one of the main leaders in that movement. And in New Jersey, we had like a group in Cumberland County meeting, a group in Atlantic, a group up in Monmouth County, a group in Bergen. I think there was a group in Passaic. There was like 6 groups meeting in the state. And what New Jersey did was they started a consumer advisory council and started having meetings in Trenton. And suddenly when the powers of like one group came together, as all those groups coming to meetings in Trenton and talking about what the division was doing well and what the division needed to look at. And one of the things that we first started with was, when you got admitted to a psychiatric hospital back then, you were fingerprinted. Now, what does that tell you? It was like you were treated like a criminal.
Yeah, there's that stigma.
Yep, there's that stigma. So one of the first things that the State Consumer Advisory Committee set out to do was to change that practice or that policy. And after pressure and work, that policy was changed, and they ended, fingerprinting at the state hospitals. So, even at some of the most bureaucratic kind of policies, you can create change.
Yes, I mean, and that just doesn't happen anymore. That doesn't happen anymore. And people got to remember that that is progress. I always bring up the example, I just talked about this last night in our Inclusive Healthy Communities grant, the 2017 example when they wanted to repeal the Affordable Care Act, sometimes known as Obamacare, which would have impacted people on Medicaid and impacted people with pre-existing conditions. And it was the advocacy of people with all types of disabilities that stopped it. I mean, that was going to happen if they did not mobilize and stop it. That was going to happen. That was a big chance that was going to affect other people. And it was really people with disabilities who stopped that. So when people say I can't have any impact, what can I do? That's just an example of what can happen. What can happen. Because if you remove the disability community from that equation, I truly believe that would have been repealed.
And I think that's still an issue going forward in this year's presidential campaign. People need to seriously look at the issues about what's happening and how they feel like that will affect them. If, affordable health care is an issue for you, you need to look at both parties and see who's got the platform that best suits your circumstance, and then you need to find other like people and make sure that you're speaking up and talking loudly and listening to what's being promoted. And that's important. I think it's probably never been more important than in this year.
I think that's so true. And you really got to understand that if you're not using your voice, other people are. So, you hear sometimes I'm not interested. Well, you may not be interested in politics, but they're interested in you. So you really have to look at, the issues and go with what suits you, what you believe in. So I just think that's so important not to give up your voice, give up your influence, and give up your ability to make an impact. Let's talk about the stigma-free campaign and what that is, so people understand how we can combat stigma. Like, where are we with that? Like I said, you have a lot of experience. So have we made progress? What do you think of that? Is that stigma still out there? And how can we combat that?
Right. So in New Jersey, there has been for a number of years, there's these each many counties throughout the state, not every county, but many counties throughout the state have a stigma-free initiative. There's stigma-free committees, there's stigma-free signage, and more recently, the Governor's Council on Stigma-Free has reinstituted itself and gotten very involved in what's going on across the stigma-free initiatives. Some of that initiative actually really started around mental illness and educating around mental illness, but we've seen it shift across the counties, or some of the counties in New Jersey, where it's now clearly representing both mental health and substance use disorders. And that goes along with what the Division of Mental Health and Addiction Services has also done, is they have combined addiction services and mental health into one division, and a lot of the funding comes through that same silo. So there is more of a push to work collaboratively as opposed to in silos of addiction services or substance use services and mental health. It's more combined. So the Stigma-Free Atlantic Collaborative, it's a countywide program that aims to reduce the negative beliefs associated with mental health and substance use disorders. And one of the things that we're charged with, this collaborative, is to raise awareness around mental health and substance use disorders. And we kind of have a vision to create a culture where residents feel supported by their community and feel free to seek treatment for the disorders without fear of being outcast. Because one of the things that's evidence that statistics show is that people who feel stigmatized or are afraid to come out and talk about their issues are less likely to get help. And the longer you are dealing with a mental health or substance use disorder without help, the worse it can get. So really, stigma is kind of a mark or a disgrace, because people say, well, what is stigma? It's kind of a mark or a disgrace which results from the judgment of others. When an individual feels labeled by their illness, they experience both prejudice and judgment. And these experiences bring out feelings of shame, embarrassment, distress, hopelessness, reluctance, and also a reluctance to seek or accept help. As a result of this, that's one of the primary reasons people aren't getting the help that they need when they experience a mental health or substance use disorder.
Yeah, I think that's so true. And like I said, do you think we've made progress in that area, or like where are we in that? Like how do you feel about that?
We're starting to make progress. I always say that there are times in our life, there have been times in my career where there has been a marked acceptance of mental health. I joke all the time, especially in this county, about before Superstorm Sandy hit the Jersey Shore, I could stand on my head, I could be giving away money, I could do anything, and I couldn't get a mayor or anybody from City Hall across this county to call us and utilize our and ask for help from our services. After Superstorm Sandy, when we hit the ground with New Jersey Hope and Healing, and we had disaster crisis counselors in every community walking the streets, suddenly the mayors and the construction offices and the code officials started to understand that it was okay to talk about mental health, and everybody was experiencing a little bit of a crisis, and we were kind of the accepted service, and people were calling, I had Ventnor mayors and Margate and Brigantine talking to them on a weekly basis about groups that we were starting in their communities and how we were offering services to the people and we would have people from City Hall call us up and say, I'm worried about so-and-so that lives at this address. Can you guys stop by and see this person and see how they're doing? It was an enlightening time, but now we're a decade plus past that, and City Hall people have changed, and we kind of got back into that comfortable thing where it wasn't cool again. But then we had that pandemic, and then suddenly everybody was starting to talk again about mental health, and how it was affecting everybody, and it was okay to talk about it. And I think we're getting there. We got a long way to go, though.
Right.
You look at kids in schools, and we still got parts of our population, men as a big part of the population still, there's a lot of shame and embarrassment, and that tough guy, I don't need help, I don't need to talk about my mental health. It's that machismo attitude. And culturally, we have a lot of various different cultures in this community that are afraid to or will not discuss mental health. So we've got a ways to go.
Right. I think that's a good point. And what can we do? Like, I know it's kind of a big question, but what can we do in our lives to combat stigma? Like, what are some like little things we can do to combat stigma? Like, how do we break that, or at least make it better, in a small way?
So I'm glad you asked that question, because that really is at the heart of some of the work that the Stigma-Free Collaborative is doing in Atlantic County. On our website, which can be reached through our main website, mhaac.info.
And don't worry, everybody, it'll be in the description of the podcast episode, so the link will be there. So
thank you for saying
that. You're not gonna have to track it down.
So one of the things that we have on that website are we have created toolkits, and we have various toolkits. We have a toolkit for schools. We have a toolkit for organizations, like civic-minded organizations. We have a faith-based toolkit. We have a toolkit for universities. We have a toolkit for businesses, and we have a toolkit for municipal governments. And the toolkits give interested people a path to what can they do in their community to help reduce stigma. And it can be everything from hosting an event or hosting a fair to handing out brochures, with the big push nationally with the 988 line, that's really to prevent people from completing suicide. It is important that information gets out. Well, it would be really a good time for a local community, say, I don't know, just pick a town in our county and that may want to do some education this year for their residents and say, send it out with the tax bills about something about, did you know about the stigma-free collaborative, or did you know about the 988 lines? There's all kinds of different things that can be done. But in a more personal way, you asked how an individual could do that. And I would say that we need to be aware of language, and we need to be aware of those jokes that are said at places, and to help in a kind way to kind of say, oh, you know, that person that you just called a crazy or nuts, my uncle has a mental health disorder. And those are the kinds, that kind of is the kind of language that is stigmatizing and stops people from getting help when they really need it. So it would be really good if you tried not to use that stigmatizing language. So like even helping people understand that it's okay to talk about these things, allowing people living with the disease to feel supported in their community so that they can decrease the feelings of isolation and shame, talking about resources, talking about why is it that they think it's, you know, that it's okay to use stigmatizing language. For example, if that person that just called somebody crazy had a loved one that had mental health disorders, how would they feel about somebody calling their child crazy?
Right. And I also think it's important if you do have some personal experience and are comfortable talking about it. And that's why we talked last night too about the importance of storytelling. And you're comfortable talking about telling your story about what's worked for you. Like, I know I've gone to therapy and it was amazingly helpful for me. And I think that people, that helps break the stigma too, because they see other people doing it, normalizes it instead of it being like, oh, that one person with that mental health struggle. And as you said, the statistics show, especially since COVID, especially with the rise of social media amongst young people, it's grown immensely. So we need to normalize it and make sure and make people understand that it is just a part of the human condition. There's nothing abnormal about it. There's nothing abnormal about it. It's just, it's the way, it's why I don't like terms like special needs for people with any type of disabilities, because it makes disability not a normal thing. Disability of any type is just a part of nature. It's just a part of the human process. And I think that that's what we're aiming to do when we try to break down these barriers.
I think that people also don't recognize how mental health disorders, untreated mental health disorders, can also increase their chances of serious health disorders. Like 40%, people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than any other buddy in the general population. So people with serious mental health disorders are nearly twice as likely to develop these kind of conditions. So it's important to get help for that mental health so you don't have other coexisting issues develop.
Yep, it's all connected. It's not separate things. It's all
Right.
connected. It's just health.
Right. Brain's just at the top. It's all connected. Exactly.
It's all connected. So I think it's so key. I think this has been a great conversation. And I think that anybody who's interested in learning more about getting involved, I'm really going to push again our Inclusive Healthy Communities workshops, which we'll put the information again in the description below. Anybody can get engaged. You can learn about all different types of skills to be a better advocate and how to craft the story and learn about democracy. It's a really great program. It's virtual. We really appreciate our funders and the Division of Disability Services funding us. And I just encourage people in their own lives to do what Vicki says. Watch what you say, get involved where you can, and you can really have an impact. Again, impacts can be small too. I know we all have overwhelming lives, but there are ways to make a world a little better without being overwhelmed. And also taking care of yourself is the key to everything. So take care of your mental health and don't be ashamed of that. Do you have any closing thoughts, Vicki, as we as we end.
I will remind or go back to the fact that our website is mhaac.info, and then we have the collaborations that we're involved with, and one is the Stigma-Free Atlantic Collaborative, and we are available to do presentations on stigma-free for your civic group, church, organization, synagogue, whatever you would like. We also have trainers that can do QPR training, which is a suicide prevention, question, persuade, and refer. And we actually have some that do it with support, emotional support dogs. So that's always fun to have them come on scene too.
Yep, the Mental Health Association is doing great work, and I would really encourage people to check out their website. It's going to be in the link below, and really avail yourself of their services. So thank you so much for doing this, Vicki.
Well, thank you for having us.
You're welcome, everybody. Bye. See you next time.